Let's talk about your skin. What is it that you're noticing about your skin that you'd like to try and address?
Well, actually, it's more that I'm noticing that there's a lot of sagging or a lot of things that are happening now with age that I'm not as excited about.
Let's talk a little bit about the phenol peel and what that means and what the purpose is and what you can expect from it. So a phenol peel, it's a chemical peel. So the idea is that we're using chemicals on the surface of the skin, and that actually peels or removes some of the outer layers of the skin. The procedure itself, the full face peel, which we will be talking about, takes about an hour and a half roughly, and that will do that in an operating room with you asleep. And so on the day of the procedure, all we'll need you to do is come in and we'll give you instructions on how to be prepared for that.
Right.
The process in the operating room is about that hour to hour and a half, and going section by section and doing each part. And then once we get to the end of that, we'll clean things off and put a topical freezing on and wake you up and bring you to the recovery area. And by 7 to 10 days after the procedure, for the most part, the skin would have healed over. And at that point, what you'll have is basically a fresh layer of skin. This, we're significantly taking off the outer layers of the skin, and the inflammation and the healing process that results from that is significant as well. And that means that you have a long time that there's going to be some amount of pinkness there. And that pink color will last about 2 or 3 months. And even after that, there'll be a little bit of a faint hue to the skin that fades. 6 to 12 months is really when everything is completely back to normal. So are there any other questions that you have about the peel or the aftercare?
No, I don't think so. I'm happy to hear about the pain is limited, and also the expectation of how long it'll take for things to come together, but I'm okay with that.
I think this is the right thing for you, and what we'll do next is we'll get you hooked up with our patient coordinator to start doing the planning for surgery.